I think that scaling a home health business is very difficult because of the human element. It's important to think about your current staffing models, how you utilize your staff today, and how that matches to your case mix. It's also important to consider whether your staffing is largely employed or paid on a per visit basis or hourly. And then evaluate your actual visit needs. For instance, what we're showing here is there's a difference, and a very significant difference, in total cost per visit of LPNs, RNs, and wound specialists. Many home health operators with a wound care program today will employ or contract with a wound specialist for consults. And in our research, many home health operators tend to staff wound visits more heavily with RNs or wound specialists due to the more complex requirements of wound care, varied patient needs, and the desire to provide the best standardized care. While that makes sense, it can also make scaling a wound care program difficult, given the difficulties of recruiting and keeping on RNs and staffing issues. So let's take a look at what this would look like in an episode scenario under PDGM. In this scenario, we have an RN completing 8 visits for a patient with a wound, needing wound care. The total cost here for this would be $687 and could actually be higher if you're paying RNs hourly and you're covering mileage costs as well. In this case, you're not only paying for high cost visits, you're also paying for windshield time. And as we just talked about, some organizations that have wound specialists will be sending these out to many more visits, which could make the cost closer to almost double this at $1,200 or $1,300. In this scenario, we look at what changes if you optimize through evaluating your staff and using your staff in different ways. In this case, the first visit is done with an RN or in some complex wound cases, a wound specialist. Then the remaining visits are done with a lower cost LPN. As the LPN can't complete the wound assessment, they use a digital wound care solution to capture a photo, automatically capture measurements, and an evaluation at the point of care. The supervising RN or wound specialist is then able to review the image and measurements and then complete the wound assessment, sign it, and lock it. This can all be done remotely and within minutes. In addition, with better visibility into how patients are tracking, we might be able to realize that one of these visits is in fact unnecessary because of how well the patients are progressing, or the patient is progressing. In that way, we might be able to reduce the number of visits from 8 to 7 by using dashboards, alerts, and analytics via technology solutions that leverage point of care solutions and connect them with administrators. We'd be better able to track the wound remotely, and we wouldn't need as many visits. The result, you could have savings of over $226, and most importantly, you just improved your margin by 30%.